Antibiotics have saved countless lives in the past century, treating infections that would otherwise have killed patients. But now there's a real fear that some bugs are developing a resistance to them, and your GP could be part of the problem. Doctors have admitted prescribing antibiotics to patients, even if they know they won't work.
Many patients still come to the doctors wanting antibiotics and are not happy until they leave with antibiotics. We all recognise those patients. We all do our best to avoid them. But even with the best will in the world, trying to get a patient out of your room sometimes requires a green bit of paper.
90% of GPs surveyed say they felt pressured by patients to hand out antibiotics. Almost half said they'd prescribed them even when they knew they wouldn't help. And by 2011, half of patients with a viral infection like a cold or flu were prescribed antibiotics, even though it's not appropriate treatment. Last month, David Cameron warned that resistance to antibiotics was a very real and worrying threat. The Department for Health has said it's working to help GPs prescribe more effectively. But one expert says doctors have become complacent after 60 years reliant on the drugs.
A lot of the things that we've grown accustomed to, like being able to treat cancer or being able to have transplants, will become increasingly difficult. Eventually, if we are very unlucky, then what will happen is that simple infections that we used to take for granted that could be treated simply with antibiotics will cause us serious diseases or even kill us.
While patients may pester their GPs for antibiotics, some say it's up to medical professionals to resist this pressure. Sally Lockwood, 5 News.